and there's also a decentralized governance. In centralized governance, decisions are taken at the peak, that's at the national level. When you talk about Nigeria, it means that if, assuming Nigeria is on centralized governance, it means that all decisions will be taken at the Federal Ministry of Health and stepped down to the state and to the health facilities. And the state and the health facilities don't have anything to decide or any high-level decisions to take. It means that even products are purchased, they are procured at the federal level and then taken down to the health facilities and not to the state or to anywhere. So it means that all decisions, all operations are decided at the national level. So you can imagine in Nigeria with 774 local government areas, and decisions will be taken at the Federal Ministry of Health and stepped down to each of the primary health care in the 774 local government areas. You can imagine when that is done, what happens. That is what we mean by centralized system of governance. But when we talk about decentralized governance system, it means that decisions are taken both at the federal and at the state level, and most of the time is at the state level. Every state takes their own decision and their own operations. In as much as the federal government will make the federal laws and policies and also provide guidance to the states, but the operations, the procurement, and other domestications are done at the state level. So in the case of this decentralized system, you find out that the federal government can purchase drugs, send the drugs to the states, and the state now sends to the health facilities. And the state can also purchase and send to the health facilities. In Nigeria, we know that the Federal Ministry of Health has their own federal medical stores. In those federal medical stores, they don't send drugs directly to the health facilities. They send drugs to the states where they're operating, and the states will now send to the health facilities. So that is what you have at the centralized. Then some countries also have mixed governance. It means that they are operating both central and decentralized, depending on the structure that they have in place. So in those countries, they will have systems that are centralized, depending on what is convenient to them. Then they have other systems that are also decentralized. So that is the mixed type of governance. Next slide. So these are the examples of countries that have centralized, mixed, or decentralized. Like in Ghana, Ghana runs a centralized system of governance in their supply chain system. It means that the Federal Ministry of Health in Ghana, they do all the decision making, they do all the procurement, and they use their Ghana Health Services to oversee all the health facilities in Ghana. Whether they're in Accra, Kumasi, anywhere they are all under the governance of the federal authority. And even the national health insurance in Ghana is run by their health authority from the federal level. It is not like in some other countries like Nigeria, where a state can have their own state health insurance and operate it. In Ghana, everything comes down from the federal authority through the Ghana health systems to the health facilities. So it is directly from the top. In Kenya, they have a mixture of centralized and decentralized system of governance in their health, in their supply chain systems. So in Kenya, they use KEMSA, that's the Kenya Management Supply Agency. So the Medicine Supply Agency, sorry. So they use KEMSA for decentralization. Then they also use their Federal Ministry of Health to reach out to the healthcare facilities at the county levels. So in Kenya, they have a mixed method of governance in their supply chain. But in Nigeria, we have a decentralized type of governance in our supply chain systems. In as much as the Federal Ministry of Health makes the policies and formulates the regulations, they step it down to the state governments. And it's the state government that decides on the operations that they will use. It's the state government that decide on the agencies. The state government have their, in as much as they also run the federal health insurance. All the state governments in Nigeria are also authorized to start their own health insurance. Like in Lagos State, there's Lagos State Health Insurance, which is run by Lagos State, and community pharmacies, private and public, they're all involved in it. In fact, Lagos State has made it mandatory that everybody is going to have a health insurance in Lagos State. Even in their procurement and in their logistics management systems, you also have the LMCU. Sorry, this is DMA, not DMU, DMA. So they also have the Lagos, logistics management coordinating units is in all the states of the federation. So every state have their own logistics management units. They also have their own LMIS, which is the Logistics Management Information Systems. Then every state also is authorized to have their DMA, which is the Drug and Medical Consumables Agency. They set up their own laws and rules, their regulations that govern that. They have their gazette. They have their policy documents in all the states. What operates in one state may not be what operates in another state. All the states are authorized to domesticate the DMA, and then they use it to procure their drugs. Some of them are even doing public-private partnerships in their drug, in their supply chain system. And the state governments, then they take down the drugs to the local government areas. So local government areas have their primary healthcare facilities, and they are all overseen by the state. So Nigeria has a purely decentralized system of governance in their supply chain, in our supply chain system. Next. So now we are going to have a 10-minute plenary section on who is the primary provider in Nigeria's health supply chain. So we want to discuss, having learned from what we have learned as from centralized and decentralized and mixed method of governance. So we want to discuss in Nigeria who manages the supply chain, who is the primary stakeholder of the supply chain process, who is the primary stakeholder in the organizational process, then the stakeholder management, who is the primary stakeholder, and who also is the primary stakeholder in allocating resources. So we are going to have 2 groups, and each group is going to have their team leader, their group leader. So the group leader is going to...
I think it's better to, sorry to interrupt, since we are only 9 or 10, I think it's better to have a plenary session.
Okay, for just one group.
Yeah.
Okay, it's okay. It's okay. So we are going to have the plenary session. Then there will be a leader that will collect all the answers to the questions. Thank you very much. Would you want to lead the plenary section? Hello, Pierre.
Oh, Pierre. Oh, okay, I'm sorry.
We call you Peter in Nigeria. I know
Yes.
Pierre in French, in Nigeria is Peter.
Yeah,
so
Peter,
I would like
Peter works
like
well.
to lead the plenary section, yeah.
Now, you know better than me the context of Nigeria. So probably we could lead together this session.
It's okay.
Okay, so who would like to talk about it? Who's the primary stakeholder in Nigeria's health supply chain? And we have 3 examples. Who manages the supply chain process, the organizational process, the stakeholders management, and the allocation of resources. So we would like to have people taking over the discussion and then describing what they think is the case in Nigeria. Over to you guys. If in half a minute nobody's raising the hand, then I think Doctor, you will have to select somebody.
Okay, Abubakar Suleiman, can you tell us who do you think is the primary stakeholder in Nigeria's health supply chain, in the supply chain process? You can unmute yourself.
Exactly.
Hello, good afternoon.
Good afternoon.
Yeah, I hope you can hear me.
Yes.
The primary stakeholder in Nigerian supply chain system is National Product Supply Chain Management, which is under the Federal Ministry of Health.
Thank you very much.
Do you think that this agency is managing the supply chain process, the organizational process, the stakeholders management, and the allocation of the resources?
In terms of resources in this part of the world, it's most support for them comes from mostly the development partners. The resources from government is there, but not that much to be able to, for them to be able to carry out their expected role.
Yes, but what you're talking about is we're talking about the allocation, not where it's from. So imagine whose authority, whose organization will talk to UNFPA, to USAID and say, can you please finance us? Can you please finance this activity of this kind of products? So we're getting, remember that the topic is about governance. Who's conducting, who's governing, who's making the decision?
Absolutely. So just as you said, in terms of support, in terms of where the funding comes, yes, they reach out to various agencies. It could be donors, it could be UN agency to support in one area or the other, which most of the times they get the support. And even presently, they are being funded by a Global Fund to carry out certain activities.
Yes, but who's leading that discussion, that resource mobilization? This is the question that we're asking here.
It's the coordinator of the National Product Supply Chain Management, and then supported most of the times by the Director of Food and Drug, which is a higher level, but most in terms of funding, to source for funding is led by the coordinator of National Product Supply Chain Management, with the support from the Director of Food and Drug, who is the overall boss.
Okay. That's at the federal level. What of at the state level?
At the state level, ordinary at the state level is supposed to be the Logistic Management Coordinating Unit, which is like an offshoot of the National Product Supply Chain Management at the federal level. But at the state level, it's led by the LMCs, but it seems not to be as strong as the National Product Supply Chain Management at the federal.
Okay, thank you very much.
Yeah, thank you, ma'am.
Thank you.
Ahmad,
you have Josephine that is online and with the microphone open. Do you think it's an indicator that she would like to speak?
All of them are muted. Okay, Josephine Abiri. Josephine Abiri, who is the primary stakeholder in stakeholder management in Nigeria's health supply?
Hello, good afternoon, everyone. Can you hear me?
Yes, very well.
The Federal Ministry of Health.
Okay.
Okay.
Stakeholder management. And
what do you think they're doing in the four cells at the bottom of the slide? Do you think they manage the process of the supply chain? They manage the processes, the organizational processes? Do you think they, the federal organization, is managing the stakeholders as well? All the above? Over to you, Josephine.
And the stakeholders, and maybe we may need to identify who are the stakeholders.
Yes, exactly, but that's the question.
Yes.
Anyway, Josephine is gone mute. Over to you, Dr. Sakamaka.
Isaac, would you want to? Hello, who is speaking?
Yes, can I hear
you? Okay. Who wants to speak? Festus, okay, can you?
I want to make an attempt. Yeah.
Okay.
Good evening, all.
Good
Because
evening.
Nigeria runs a decentralized system of governance, at every level of the supply chain process, I think there are stakeholders at various levels because decisions are taken at those levels. So, like at the national level, we talk about federal ministry of health. Then at the state, we talk about the state ministry of health. At the local government, talk about local government area or authority. Even at other partners, like in Nigeria, we have National Health Primary Care Development Agency that supervises or takes care of primary health care center. There are stakeholders in that aspect. And then I think it's also dependent on the program. Donors are stakeholders as well. And then even the healthcare providers are stakeholders at the level where they are operating.
Exactly.
And I think, so when we talk about primary stakeholders in this situation, it is not a one organization or a one aspect of it, because at every level, especially in Nigeria where we have the decentralized system, at every level there are stakeholders that are core. Decisions are taken by those ones. So they are stakeholders at that level. I don't know if I have made any contribution. Made my point.
Yes, you're very correct. There are various stakeholders at various levels, and you have identified them. And at the state level, every level manages their own stakeholders, because the stakeholders at the state level are managed by the LMCU. Then the stakeholders at the federal level too are managed at the federal level. So you have made very good contributions. Thank you very much. Is there any other one? How many minutes do you still have? Sure, how many minutes do you still have? Would you want to make
I think,
any?
yeah. We could invite Abu Bakar to make a contribution.
God, okay, want him to talk. Okay, it's okay. Abu Bakar.
Okay, good afternoon, everyone.
Good afternoon.
Good afternoon.
Yeah, I actually agree with the last speaker, where he made mention that we have different stakeholders at different levels. We have at the national level, at the state level, the local level, even in our health facility, and also the international organizations. At the national level here in Nigeria, we have the Federal Ministry of Health, we have the National Primary Healthcare Development Agency, we have NAFDA, that's our National Agency for Food and Drug Administration and Control. We also have the National Supply Chain Integration Project, that's at the national level. While at the state level, we have at the state government, they handle, they are also stakeholders. Then we also have at the local government, that's the chairman of those local governments or the authorities involved in the local government affairs. Then
Now,
we also
question. Yeah, go ahead. Sorry.
The health facilities also.
So can you tell us who's in charge, who conduct the supply chain process? Number one. Number two, who's conducting the organizational processes? Number three, who manages the stakeholders? Number four, who allocates the resources? So basically the 4 squares at the bottom, who's doing that?
Okay, let me give it a try. I don't know. I believe for the Federal Ministry of Health, they just see the overall policy, they like guide the policy and also coordination. They develop the policy and also coordinate it. So at the national level, what they do is they're also responsible for procurement, distribution, management of, example, vaccine and other essential medicines. Then even at the Federal Ministry, at the national level, example, the Federal Ministry of Health, they're responsible for allocation of resources.
Okay.
I don't know if I'm making sense.
Okay. So you said federal level, they do the number 3 and number 4, and they do a little bit for vaccines, supply chain process, operationalizing a supply chain, but not for every kind of product. Is that correct?
Yes, that's correct.
Then at the level below, which is regional, or this is state?
Yeah, at the state level, they are responsible for managing the health supply chain at that level.
Okay, so supply chain, operationalizing supply chain of the state level, they do conduct the processes, the organizational processes. Do they manage the stakeholders?
No. No, they don't.
Okay.
They don't.
Do they allocate resources?
Yes, to some certain extent.
Okay, which resources alors? Which resources that are not managed by the regional, by the federal level?
No, the federal level manages like virtually all the resources, but you know they allocate. So they allocate to this.
Okay. Okay, and so the city level, the lowest, and the health centers, they do allocate resources as well? They do manage stakeholders? Or they do only the first two?
That's at the local government.
Yes.
At the local government, they do allocation of resources, they do supply chain processes, and also organizational processes, a bit of organizational processes.
Okay.
That's what I feel. That's what I feel.
Okay. Excellent. Dr. Ukamaka, are you satisfied by the responses?
Yes, but the state government also have their own funds that they spend, and they also do a lot of public-private partnership. So they also get some resources from the private sector to strengthen the public sector. So the federal government gives allocation to states and local governments, but the states also have their own funds. They also raise their own monies, and they also allocate their own funds at different levels. I know local government, they are primary health care centers, and they are directly under the state government. So money is allocated to them from the states in most of the times. And many a times their medicines are either essential medicines or program medicines. And some of the program medicines are free, but the essential medicines are either they're paid for or they're under insurance, but the major decisions for the local government are taken by the state. Thank you.
Okay. So thank you for your contribution. Let's move to the next slide. Dr. Ukamaka? Yes?
Yeah,
okay.
Yeah, thank you.
Okay.
So what affects decision making in supply chain? You know, we are talking about governance. And now we are talking about what affects decision making in funding, in human resource, and in information technology. So funding policies and availability of funding impact decision making, whereby leaders allocate available funding for supply chain. Sorry, you have changed the...
Oh, sorry. Yes.
So, but sufficient funding can lead to inefficiency and corruption. So, what are the things that can affect making decisions in supply chain? One of them is funding. Then another part again is human resource. So the availability of human resource in the state or at the federal level. So you know, they can affect recruitment, retention of staff, and even performance management. When you talk about sourcing of human resource, there's also training. You know, training of human resource, recruitment, then retention of the human resource in the supply chain. So some of these things are what affect decision making in supply chain, you know, and also help to create a skilled and motivated, compliant workforce. And in this era of international health worker migration, which is affecting both mostly developing countries and LMIC countries, so the availability of skilled workforce is also one of the factors that that make decisions that affect decisions in the supply chain. Also, a sound IT infrastructure. The availability of IT and also the availability of the human resource that we operate the IT. So these are some of the things that will affect decision making in supply chain.
Next slide.
Next slide. Yes.
Yep.
Then also regulatory affairs. Regulatory policies affect supply chain decisions and make by establishing rules and standards for supply chain operations. And also the geopolitical factors can also impact supply chain decisions and making decision making by affecting trade policies, political instability, and natural disasters. And also the donor ecosystems can also impact supply chain decision making in countries by influencing their policies and providing technical assistance and promoting transparency and accountability. Pierre, I don't know whether you would like to make some contributions to this.
Yes, thank you. Thank you for bringing me in. So we talked about governance, and governance is made of the act of governing, which is conducting. And I think in my technical assistance working with Biskil and Sanjay, we always refer to the pilot of the aircraft, because the pilot of the aircraft is the one making decisions. And he has a set of parameters, information, and a roadmap that he has to follow, but that influence him or her as the pilot. But the role of a pilot is actually to make decisions. That's the only thing. He doesn't operate, he doesn't perform the supply chain, he doesn't change a tire when the tire is flat. He receives the signal that there's a flat tire in the aircraft. He confirmed that. He asked another stakeholders, a technical stakeholder, to change the tire and then receive the signal moving from red to green that actually the tire has been changed. So governance should be attached to decision making. And here we described in the key elements that will influence and affect decision making. Regulatory has an impact on governance, geopolitics as well, donor ecosystem, information. And a pilot of an aircraft cannot make a decision, and you've seen recently with the catastrophes, if that person doesn't have a board with indicators red or green saying that something is working or something is not working, then the pilot of the aircraft cannot make a decision. So technology and information is actually one of the most important parameter that affects decision making. Human resources. If you don't have the capacity, you don't have the expertise, then you don't have the leadership, then you cannot make a decision. And then what is the purpose of making a decision without funding? So I wanted you to take a step back and complement what Dr. Ukamaka said to provide you with his background. Now, let's move to a little of an exercise, and I think Shreya will help us on that, to try to allocate the responsibilities to the proper side of the slide. So, for example, defining processes. Is it a task for governance, or is it a task for management? And we would like one of you to take the lead on that. Who's going to take the lead on that? Josephine, you still have the microphone on, would you be a good candidate?
I hope you understand the task.
Yes. So basically, say to Josephine, for example, say to Shreya, defining processes, do you move into governance or do you go, do you drag it to management? Okay, Dr. Ukamaka, I will ask you to take the lead on that.
Okay. Okay, let me explain to you what we are talking about. Like, you know that governance is high-level decision making, while management is more of operational. So governance takes decisions at high level at the apex and bring down the decisions to people at grassroots or state level to manage. That's operations. So defining processes, you have to tell us, because we are 9 participants here. So defining processes, you drag it to either governance or management, and we agree. The managing stock, you have to know, managing stock, is it a high-level decision or is it management or is it operational? Then defining HR policies, is it governance or management? So I want the participants to try out this to show that they understand the difference between governance and management. Thank you. So who will take the leading?
Yeah, let me give it a try.
Okay, thank
Okay,
you.
I just raised my hand.
Excellent.
Okay. I think defining processes should go to governance. That's what I think.
Why?
Managing, because they deal with policy making, coordinations. That's why I feel
Governance.
not management.
Yes, governance. Shreya,
Yes,
thank you. Exactly. Okay.
I want to continue on the next participant.
Yes. No.
I'm
do
thinking
a
that
couple.
all of us, that every
Do a
participant.
couple.
Sorry, Pierre. I'm thinking that every participant should take part in this task, in this activity.
Hello, let me contribute. Let me take one part.
Okay.
Okay, for managing stock, I think that should be management. I think they should be in charge of managing the stock they have at any point in time.
Yes. Thank you very much. Next person. Festus. Hello.
Yeah.
Okay.
Okay.
I
Hello?
think the policy. Hello, can you hear me?
Yes.
The policies defining human resources as
okay.
the governance.
Okay, thank
My
you.
thinking.
That's great.
Hello.
Hello.
I would like to say allocating budget and resources goes to governance.
Good.
Hello? Can I speak?
Yes.
Can I add one more?
Yes, you can continue.
Designing contracts and donor agencies, governance.
Okay.
Hello?
Now, Latin
Data use policies. Okay. Hello, do I go ahead? Yeah. Data use policies, I think, should be governance.
Next person, or you can continue if no other person is
okay.
talking.
Hello.
Then
Hello?
selecting forecasting method should be management.
Good evening, madam. How are
Good
you? Well done.
Next person, Isaac, have you spoken?
Then I think selecting information system should be management too.
Setting procurement policy is the governance function. Can you hear me? Hello?
Hello? Okay, yeah.
Good evening.
Good evening.
Yes, I think selecting information system should be under management.
Okay.
Governance function.
And as well, selecting supply.
Recruitment of staff is a management function.
Yes, it's management. Likewise, selecting suppliers is also management.
Exactly.
Recruitment of staff, selecting supplier is a management function.
Okay.
Sorry, I think providing enabling legal framework should be for management. I'm not sure.
Procurement plan is a
enabling legal framework. Should it be governance or management?
Development function.
I think it's governance.
I think it should be
it's
legal.
governance.
The governance.
It should be governance.
Yes.
Yes, more of governance.
Governance. What of
Defining
defining
procurement, it should be more of management.
Then selecting information systems.
Is management.
Then for allocating budget and resources, I feel it can go both ways, depending on what level of allocation we are talking about.
But where do you think it will be most appropriate to go?
Governance.
At the top level, that's governance.
Developing procurement.
Procurement plan is a management function.
Yeah.
Same thing as developing forecast.
Then selecting
is management.
Or management.
Yes. Is management. Forecast is management. This one can go both ways. Because governance must have information. Management must equally have information. That's the driver of.
Yeah, and it's an ERP, enterprise resource planning.
But it's a driver for all.
So I think it's for the country.
Yes.
If it was ELMIS, that could be management. And so Shreya, we said allocating budget and resources. You could expand the very large because it's both governance and management in Nigeria. Is that correct? Yes, exactly.
Yes.
Is that correct, Dr.
Yes.
Ukamaka?
Yeah, correct. Yes, this is correct.
Okay.
Yes.
Everybody's happy? Is it correct? Any question? Any doubt? No? Okay. Then that's a consensus. Is that right, Dr. Ukamaka?
Sorry?
Is it a consensus?
Yes, a consensus, yeah. Allocating budget and resources should be both.
Okay.
Government and state government, yes.
Okay. Then the exercise is finished, I guess.
Yes.
Shreya, can we move to the next slide?
Exactly.
Yes. Okay. Now, we've been working about governance and how to make decisions and how processes could be allocated to governance or to management. Is there any question about that before we move on to another topic? Over to you. No question? No questions? Okay. Then let's move to the next slide. Now, we wanted to expose you to something that is very interesting and that should become a tool for yourself if you're a full-time employee in your organization or within the Ministry of Health at the federal, regional, or local level, or if you're a consultant, which is to track 3 flows: the flow of product in green, the flow of money in red, and the flow of information in blue. And why? Because these 3 flows are very reflective of the aspect that is centralized or decentralized. Meaning that in a context of centralization, full centralization, a mixed context, or a context of decentralization, then it has an impact on these 3 flows: the flow of product, the flow of information, and the flow of money. Here, we have a simple scenario where everything is centralized. As you see on the bottom, you have the central supply chain organization. And on the left side, it places orders to the supplier or the suppliers. Then this is colored in blue because the flow of information is that the central supply chain organization send a request, an order to the supplier so that the supplier ships the product to the central warehouse. And it's not a flow of information anymore, it's a flow of product. It goes green. Then the central warehouse distributes to the intermediary warehouse managed by the same organization. And then the intermediary warehouse distributes, the flow is in green, to the service delivery points, SDPs. And in return, the service delivery points, they place an order to the intermediary warehouse, and the intermediary warehouse send an order to the central warehouse or the central supply chain organization to be distributed, to received. So this setting is very centralized. Now we could see a different setting where it's highly decentralized, meaning that there's different warehouses, there's different supply chain organizations, and different district warehouses. So the flow of information and the flow of money is actually totally different. The only thing that is centralized is that most likely the supplier will be the same, but you see the flow of information, the flow of product are coming from the supplier, and are the order are coming from 3 states supply chain organization going to one supplier or different suppliers, and the flow of product coming from these suppliers are going to different states warehouses, and these different state warehouses distributes to different district warehouses, and who distribute to different service delivery points. You see how the flows are actually more complex and therefore more difficult to manage. And this is in these kind of settings that you see variations between different states the usage of different ELMIS, some states will have their own trucks, where in other states is going to be outsourced. So you see variability because there's more freedom that is given to the states compared to a centralized system. I hope it's clear to you for the flow of products and the flow of information. Now, we're trying to elaborate on the third flow, which is highly complex as well, which is the flow of money. And I would like to ask you the question, who's paying for the product? And who does it flow? Sometimes it could come from the patients, so it's out of pocket. And I suspect in Nigeria, some states are very matured in the sense that they have a universal health coverage, and therefore the insurance pays for the cost. Sometimes it's not the case. Then who's paying? The patients, and it's out of pocket money. Sometimes, as I said, it goes from public or private insurance. And sometimes this is the federal or the state government through collection of taxes. And sometimes this is thanks to donors, when donors give for free products. This is the case for UNFPA, I guess, in Nigeria. This is the case USAID. I said UNFPA. The UN agencies are often big donors, and in that sense, they contribute to make it free of charge to the patients, but that means that somebody is paying for it. It's the donors. And here we have a modeling of a flow of money in a decentralized setting. So that means that the state supply chain organization pay for the order to the suppliers. Of course, the suppliers supply the central warehouse, the regional warehouses, and after that, it goes down to the service delivery points. And here, in this example, the service delivery points charge for the product or for the medical consultation, and collect that money and pay upstream who's providing the product. This is a mixed system here where both the central and the state level organizations can collect funds from the health facilities and therefore from the patients. And both the state supply chain organization or the central supply chain organization collect that money and pays the supplier. So this is the flow of money, and it could, so you see how the flow of product is driven by the flow of information, and sometimes is driven by the flow of money. When somebody pays for the product. So this becomes a very complex system where these three flows are driven by different reasons and by different organizations. Now, the last question is to show you how information is key. because information drives everything, drives the flow of product, and the flow of product drives the flow of money. And that's the reason why there's significant investment by donors in the ELMIS, or the Electronic Logistic Management Information System, because it drives virtually everything. Number one. And number two, it enables the governance to make a decision. You cannot make a decision without adequate information. And this is where my analogy of the pilot of the aircraft is blind if it doesn't have the indicators and the data he needs to make a decision. In a decentralized system, then in the square number two, in the decentralized system, then you could have several ELMIS running in parallel. Now, it happens as well in centralized health system when a program, and one of them is the immunization program, often runs its own ELMIS because historically it has been the case. Now, I'm sorry, I'm running out of battery. I did not focus that. Now, the last point that we would like to make is without information system, then there's a risk that accountability and reporting is weak, and therefore it's a threat to the system. Let me charge here. Okay, I think it works. Yes, it works. So please be mindful when you talk about governance, how these three flows impact in a very deep manner governance. Here we have another example where the state supply chain organization, where the stock replenishment request, I mean, we modeled how the stock replenishment request move from the service delivery point to the health state health service department, then to the supply chain organization, and then to the suppliers. This is the flow of information. Sorry, it looks a little bit disconnected, but I hope in this presentation, I made you understand that these three flows are very important to define governance and to see if one of these flows is weak, and especially the flow of information, how much it could weaken the governance because the governance cannot make proper decision. We will open the floor for more Q&A. I asking Dr. Ukamaka if she would like to add something on this set of slides. Over to you.
Okay, not yet. Thank you.
Okay. Now let's open the floor to some Q&A. Who has done this kind of exercises in Nigeria, and who has some more comments to make? Let me close the door here. Over to you guys.
Hello.
Yes.
Good evening.
Good evening.
Well, you talked about the several logistic supply chain systems running about the same time, parallel.
Yes.
So in that case, now you talk about governance. Well, if there's a proper governance, well, maybe everybody may be able to send reports that may be collated. Now, with this multiple running parallel, don't you think that it will give rise to a system that is not coordinated properly, with each person running his own parallel line instead of running to be domiciled under one umbrella where the whole information can be stored. So you want to talk about malaria, you want to talk about contraceptive, all should be in one place. But now you just spoke that vaccines have been, because of the history surrounding it, is parallel that it has always been. So, but we are talking of a system where everything can be under one roof. So, and as a country, for example, Nigeria now, immunization is running its own, malaria is running its own separate. Every man is a lord and master in their own field. So, how can all this be integrated so that now, if you want to talk about all this program, there is a central warehousing for all the supply chain system? Thank you very much.
Look, you've been very good. You basically finger point one of the main issues in most countries being centralized or being decentralized. Why? Because historically, programs have been verticalized because the donor is verticalized. For vaccines, this is a specific department within the Ministry of Health, and the donor is Gavi through UNICEF. Mother and children is through UNFPA. You have the Global Fund, who has funded HIV, TB, and malaria.
Yes.
You have all these donors that actually have fragmented and verticalized the health system, and it has been forgotten historically that actually the supply chain is transversal. You do have a truck that goes from central to intermediary and intermediary to peripheral. Now, if you're not smart, then you have 5 or 6 trucks taking the road at the same time, moving from central to intermediary and from intermediary to peripheral. If you're smart, you say, I would like to maximize the utilization of this truck. Why cannot I merge, consolidate all the products? Because these trucks are going to the same places. And it's been new that donors mentioned that actually supply chain is transversal. And this is plain wrong to develop the strategic plan of HIV/AIDS and put a little box at the end. How can I manage my supply chain for HIV/AIDS products? And so what has happened is that strategic plan of the country supply chain has been transversal. They take all the little bits of every program and say, can we create a strategy out of all these bits, all these trucks, all these warehouses, all these workforce, all these governance in supply chain, and how can we make some kind of sense and align? And in doing that, one of the most basic response is to say, can we integrate? And actually, there's a huge opportunity of integration. My example of a truck. Well, if there is space in the truck, why don't you put more boxes going to the same places? This is not rocket science. Now, the issue is that ego, control, power takes over and prevent that. But when you go to the peripheral level, there's one fridge. And in that one fridge, you put all kinds of products. Now, you go to the central level and you ask the immunization program, can I put my HIV products, reagents in this fridge? No, it's forbidden because this is our fridge. This is the fridge we paid for. So you cannot use it. But actually at the peripheral level, these people are pragmatic and they use it. So yes, you point the big weaknesses that is happening in every country. And that's the reason why governance is very important, because governance will create some kind of alignment, cohesion, and will say, actually, it's stupid to have all these points, all these tracks. Can we integrate? So I don't know if I illustrated your point, but I think it's a very, Dr. Isaac, this is a point very well taken. And now I would like to acknowledge that Sanjay is back, and we're talking about disintegration on all the steps and all the functions of the supply chain because of decentralization and because of lack of maturity. And one of the examples was these slides where there's often in this context ELMIS running in parallel. Do you want to comment, Dr. Isaac?
Thank you very much. Yeah, but I think you've tried to speak to the questions and to answer it to the best of how the system should be, because from what you have said, from national, state, local government, and what is in place, it is good to ensure that you maximize this supply chain system. Just like you said, the fridge in the service delivery point contains material from Gavi, contains material from National Malaria Supply Program, HIV is in the same store. They don't discriminate. So the governance is very, very important and key to ensure that you harmonize this supply chain system for efficiency and better output for the system. And then when you need information, you can have it at a shop, like a shop where every information is obtained, but not Gavi is in Sokoto, you want malaria is in Lagos. So there's need for integration of all of it. As you integrate the movement of the supply chain, also integrate in the information gathering that is necessary for development. Thank you very much. I appreciate it.
But you're right, saying that I explain the reason why more than what should be done. Indeed, integration enable the maximization of any kind of resources utilization, being the labor, the workforce, being buildings, being equipments. That's the best. And this is gonna happen because money is going and donors' money is gonna reduce because Nigeria is gonna graduate to upper levels. So that means that at some stage, somebody will have to pay for that. And patient might not be willing to pay for that. And government will not raise more money by more tax. So that means that savings should happen. And this is where governance is very important, but governance not an empty shell. Governance as a decision maker, and who could make this kind of very harsh decisions is good leaders. And often this is clear that if you don't have the good leadership, then change cannot happen well. Over to you, Sanjay.
Yeah, I'm just so first of all, sorry for being late. In fact, I was in a meeting with African Union, which is represented by Nigeria as well. So I was kind of in the continent itself. So pardon me, that meeting went a bit late. But before I begin, I would like to hear from Zainab Abubakar. She has her hand raised. So, Madam Abubakar, if you could speak.
Yeah, thank you very much. I actually want to know, is it possible to combine centralization and decentralization supply chain in a country? Combine the two concepts?
Indeed. In fact, I don't know whether this discussion has happened during this session or not, but generally we also asked in the beginning, what do you think whether Nigeria is a centralized or a decentralized concept. And generally, we always see a lot of discussion around that. A lot of professionals from Nigeria come and say it's a decentralized system, while a lot of professionals would say it's a mixed system. And indeed, Nigeria is actually a mixed system, which is a combination of both centralized and decentralized. It actually depends on how, first of all, how your health system is organized in the country. Now, in Nigeria, if you look at the administrative structure, you have a federal government who's running the country as a whole, from policy making to financials to a lot of issues. But if you look very specifically into health, then the federal government, uh, provides policy level support. It provides guidance to states. Of course, there is a financial element to it, but then it is the states, respective states, who are more responsible for their own health services and supply chains. So what happens in Nigeria is that while there are certain programs which are heavily supported by the federal government and the donors, there are the essential medicines, most importantly, that is what is managed at a state level. So in the case of Nigeria, both are equally important. When we look at governance, one, governance from the federal government is very important, where you see organizations like NPSCMP, which is now coordinating across LMCUs and DMAs across states. While at a state level, then the State Ministry of Health, the DMAs, and the LMCUs becomes even more critical, because not only they have to manage their own essential medicine supply chain, they also have to work with the federal government in managing those programs. For example, HIV, TB, malaria, vaccines, or reproductive and maternal child health programs, which are largely supported by the federal government. So yes, in a country, it can be mixed. Nigeria, in fact, it is mixed, but it also depends on the size of the country. Now, if we go into a small country, say Uganda, which is probably about a state in Nigeria, decentralization from a logical standpoint is, it doesn't really make sense. So, in a sense, in Uganda, the system is largely centralized. There is a central body which coordinates all the health services across districts. There is a central procuring body. There is a central warehousing system, and products are distributed directly to the hospitals and the health centers, with some intermediary storage services, for just for transit purposes. So it really also depends on the size of the country, how the policies are developed, what are the different roles with respect to how the governance in general, not just for health, but how the administrative structure of the country is organized. So all those things eventually impact how your health system is organized, how the flow of products are organized. And I know that you have gone through flow of money and flow of information as well, where we are discussing how those informations are flowing from bottom up, for example, because information starts at the health facility, or at the house, or at the hospital. So Pierre, do you want to move on, or do you want me to take over? You would like to go? I mean, that's totally your choice.
You take over if you want, because we
Yeah.
done, and we were at the Q&A.
But let
Okay.
me make a little comment.
Yes, please.
Sanjay, you're welcome.
Thank you.
I just want to add that in Nigeria, we have integrated to a reasonable extent the product of the donor agencies. What we are still struggling to do now is to integrate the LMIS, and also to integrate the donor funded products with essential medicines. I think that's the level where we are now, because essential medicines were not integrated. They were running parallel to, if you come to a particular state, this store is store for public health programs. This store is called for essential medicines. So we are trying to integrate the two, in addition to also integrating the LMIS. But for donor-funded products, that has been integrated, and that's what NSKIP is all about. That's Nigerian Supply Chain Integration Project. Thank you.
Yes, excellent. So is the is the Q&A finished? I mean, if there are other questions, then we could answer. Please, if you can raise your hands, or you can also unmute and speak, because right now no hands are raised. But otherwise, we could move forward with the information side of things, because there is also an activity which we would like to do today during the time that we have left. And just to, while someone is thinking about any question, so Madam Okafor, what you suggested is what has been happening in a lot of countries where the donor funded programs are becoming integrated, and those systems have become, integrated in a sense that data is flowing from bottom to top. But when it comes to the country-owned essential medicines supply chains and programs and data, they are not always, their flow is not always very smooth, and most of the problems can be found there. Those integration with the essential medicines program are ongoing in several countries, Nigeria included, and there is a lot of support, from skills to infrastructure to systems and processes are needed everywhere, including Nigeria. So even say there are some states who are doing better, while there are some states who have to invest a lot in people, in processes, in systems as well. So if there are no further questions, then we can quickly discuss the flow of information, which is the complete opposite of your flow of products. Now, as you see on screen, this is an example from a decentralized system where each state, now very specific to Nigeria, of course, where each state, is responsible for managing the supply chain of products, in their own geography. And hence what should happen is that all the service delivery points from where the products are being dispensed, data should be collected from that source, and then should be consolidated at a point, whether that is the, for example, in case of Nigeria, whether that should be the LMCUs or the DMA. And then from there, whatever data has, implication for national programs should be shared with the federal government, or whatever data has implication only at the state level, then they should be utilized to make further decisions on supply, be it procuring more products, be it distributing more products to the health facilities, or any other decision that probably is needed, whether you need redistribution, um, or you want to recall certain products. All that is dependent on that flow of information coming from the service delivery points. Okay, so there is the Q&A here. After that, the last part, we will not be able to allocate, of course, 60 minutes now. I don't know whether we could do it in groups, or maybe we could do it directly, in a single plenary. Madam Okafor, do you think we should do it directly in a plenary where I could share my screen and we could just discuss with everyone, because we even don't have we don't have everyone. Yeah, we
I think
don't
we
have
can do it
everyone
together
turned up
because we are
today.
few. Let's do it
Yeah,
in
yeah.
one group because there are just 9 participants.
Yes. So what we could do is, one, of course, we will discuss right now, and then Shreya, please send this document as homework to everyone, and then ask them to share their responses on the WhatsApp as well, so that everyone can also learn from each other. So very quickly, let me, Shreya, can you actually share? You have that, so if you can share the governance exercise so that we can start to discuss. Excellent. Now, so this is as we are talking about governance as a whole, as you have gone through the session, you have seen how governance includes people who are at the helm, the leadership. Governance also means that there should be a right type of system. Governance also means that there should be the right type of resources provided to run the system as well, which comes from the system. Now, the same concept of governance can be applied in various flows as well. And for example, today what we are going to discuss is how we can apply the concepts of governance into the flow of data. So Shreya, if you can make the screen slightly bigger so that we can read and discuss clearly. So in this case, in this exercise, we want to discuss the ideal scenario of flow of logistics information within the supply chain, which means the data that is collected at any service delivery point or any health facility, how should that data flow in the most effective manner to make the right decisions? So we have already listed down certain questions which would help you in articulating this exercise of data governance. So the way we will do this is I will start with the first question, and then we will listen from different participants one after the other. And then Shreya, you will write a small summary based on what is being discussed on the right side. And then later we will share this document with everyone who's present in today's session as well. Okay. So to start with, when we talk about governance, we should start with an objective or a purpose. So the first question here is, what is the purpose of collecting and analyzing data with respect to supply chain? So the floor is open for anyone who would like to contribute. So what we are trying to understand at the beginning is, what is the purpose of collecting and analyzing supply chain data? Why should we do this? Anyone?
Hello, may I try?
Yes, please go ahead.
Okay. I think the purpose of the data collection and its analysis for the policymakers or the implementers to make an informed decision. And making informed decision is for the purpose of providing effective and efficient, improved care to patients. I don't know if I said anything.
Yeah. So you said we need data to make informed decisions in supply chain. Okay.
Yes.
Dr. Isaac?
Hello.
Yes, we can hear you.
Yeah, another purpose of collecting the data as well is that it give a picture of the utilization of the services, whether the product or the services that the supply chain is supposed to provide over time. And then, like my colleague has said, it gives you the idea of to make decisions, not just anyhow decision, but decision based on information that has been gathered over time, and then to find out whether you can upscale or reduce that program.
Yes, okay.
Because of like utilization or non-utilization. Thank you very much.
Okay, so one point was again the same, decision making on supply chain issues. The second was to understand the extent of, I'm just summarizing, so correct me if I'm wrong. to understand the extent of health services that is required at a certain location, for example. I think that's what you said. So let's pause here and then listen from Zainab. Zainab, over to you.
Okay, thank you very much. For me, I think one of the reason or the purpose is to ensure efficiency, transparent and accountable logistic operations.
Okay. To
Like
bring
the operations should be
accountability
accountable.
and to bring accountability and transparency to logistics operations. Yes, of course. Isaac also mentioned like an extent. Okay, we've written. He said whether we need more or less. So those kind of issues can be uncovered when we collect and analyze data. I think that's what he said. I mean, I don't know what your name is. It suggests Huawei. So please, you've raised your hand. You can speak. Please introduce yourself very quickly.
Okay, good evening all. My name is Hafsat Muhammad.
Okay. Hello. Please carry on.
Sorry, I didn't identify my name on it. I think it can reduce cost as well of supply chain. We have informed information. We can reduce cost of the logistics as well.
Okay, so to reduce cost of supply chains over time, yes, that's a fair point. If we know, if we have all the data and we analyze it properly, we should be able to reduce the cost of logistics over a period of time. That's correct. Excellent. So these are some high level purposes. We're almost there, so I don't want to keep asking the same question. But let's go to the next one where we want to make it a bit more specific. We said that yes, we need to use data to make the correct decisions. Now, what kind of decisions can you make in a supply chain when you collect, say, stock data, from the service delivery points or from the health facility? So what kind of decisions can you make when you're collecting these data sets?
Hello again.
Yes,
Hello,
please go ahead.
okay.
My name is Professor.
Yes.
I think the data can be used to make a decision for forecasting, demand forecasting.
Okay, so let's stick with one. So let's everyone else also contribute. Abu Bakar Suleiman, please, you go ahead. Festus said,
thank you.
Sorry, 1 second. Festus said demand forecasting, Shreya. So you can write demand forecasting. Yes, Abu Bakar, please carry on.
Yeah, it can be used for facility to resupply to facility and restocking also. That's to restock facilities.
Okay, to for restocking or there is the correct term for this is
Resupply.
resupply. Yes. Yeah. Okay. Zainab and then Josephine. First Zainab, then Josephine.
Okay, I think it can be used for audit trails and also to check data quality. Yeah.
Okay. Audit trails slash quality of
data.
Yeah, data quality, yes. All right. Josephine. Josephine, can you hear me? No? Okay. So who's next? I think if Feniva, I don't know if I'm pronouncing your name correct. Okay. Anyone else wants to contribute here?
Yes, I think it can also help in training and awareness.
Say again.
I said I think it can decisions based on data can give us information or give us a guide on training and awareness.
Okay. All right. Training of staff.
Yes, training of staff, awareness
Okay.
programs also. Yes.
Awareness programs. Okay. Yes,
Okay,
Hafsat,
hello,
please.
my name is Amina.
Okay, Amina, go on.
I think when you collect data, it can help you to check for accountability.
Okay,
To
so
be
let's
sure that
yeah, that's correct, Amina, but let's focus more on supply chain issues. You know, because data can be various kinds of data. Now, here we are talking very specifically about supply chain data. So data like stock data like what is the amount of stock that you have and what is the amount of stock that you have consumed, like consumption data. So the first couple of points were very specific to supply chain. So if you have any supply chain decisions that you can take, let's focus on them first and then go on to some other decisions like training, audit trails, and what you mentioned. So Hafsat, do you have any supply chain decisions to so that we can add
Yeah,
here?
I think it can help us also in developing procurement plans if
Yes,
we have a
yeah,
good data.
yeah, indeed. So developing procurement plans, that's correct. Anyone else would like to contribute supply chain decisions that can be made with the data that we're collecting?
Yes, I think it can help us also in inventory management.
Okay, yeah. Managing inventory of products, correct? I think Isaac or someone else also wanted to say something. Or Mariam has now unmuted. So anyone can speak. Please go on.
It improves logistics management.
I think we covered that between inventory and forecasting and procurement, no?
Okay. Can I say it enhances visibility and transparency?
Yes, that's correct. Enhancing visibility of um, supply. So, which means that having more visibility on what products are available at any given point, what products are in transit, cost of products, for example, or even places where the products are stocked out, or places where there are overstocked, or any other issues would you could have better visibility. So you can make those decisions as well. Yeah. So let's quickly go on to the next question because we have covered a lot of issues on this one. Now, the third question is a fairly simple one. Uh, with respect to a supply chain, uh, what are all the levels? Levels mean source or locations from where you should be collecting data, supply chain data. Yeah, Zainab.
Okay, let me give it a try. I think at transaction level, we should be able to collect data. Hello?
Zainab, do
Can you hear me?
you mean health facilities, consumption at health facilities?
Hello.
Yes, that during orders, during shipment, and even during payment.
Hello.
Sorry, Zainab, we are not able to hear you. Say it again.
Okay, I said I feel one of the sources is at transaction level. That's when placing orders for supply or during shipment.
But at what level? So at health facilities, like for example, in the case of Nigeria, where from where exactly the data will be collected? With what is the location?
Hello.
I'm looking at
Yes,
from
we're
from the
coming to you very
supplier.
quickly. Oh, from the
The
supplier.
federal
You
ministry,
mean the
yes,
you mean the manufacturers or the
yes, from the
suppliers, distributors?
between
Okay,
the Federal Ministry of Health, for instance, and the supplier.
okay, so let's write supplier and distributor. I think someone was trying to speak. It was Isaac or who was that?
Yes.
Abu Bakr. Yeah, Isaac, please go on. Isaac, please go on. You have muted yourself.
Yes. At the service delivery point, I did.
Yeah. Service delivery points for consumption data, correct? Abu Bakar, please go on.
Okay. You can also get data from the warehouses.
Yeah. We
Stock
can
report
collect
from
data
the
from
warehouses.
warehouses. Zainab, have we already covered something that you wanted to say? Or do you have anything else? Because you had your hand raised.
Sorry, I'm
Yeah,
Hafsat.
Hafsat,
I
sorry.
also
Yes,
wanted to say about the warehouse data because that one too is
warehouses.
essential before it
Okay,
gets to the
excellent.
services. Mm.
Okay, so now if we contextualize it for Nigeria, so the first thing would be your health facilities, service delivery points, then and those are at your local government levels. So in some cases, your LGAs would also have access to certain supply chain data in some states if they are fully integrated with the system. While in other cases, you could also collect data from the LMCUs and the DMAs because a lot of data goes to them. Then, if we look at warehouses, there are, first of all, stores, probably stores at the LGA levels, then stores at a state level, which are managed by DMAs. And DMAs, they could call it a store or they could call it a warehouse. Then, like I don't remember who said that. Data could also come from suppliers or distributors. Now, that data is generally about the time by when products should reach the country or reach a particular state. That could also include the volume of products being shipped. So those kind of data can also come from the suppliers, distributors, or manufacturers themselves. Okay. So each source, each point, we collect different types of data. Okay, so service delivery points, we are collecting consumption data. At stores and warehouses, we're generally collecting, stock issue, stock on hand, or we're also collecting data in terms of what is the value of stock you may have at any given point in time, or what is the volume of stock you may have at any given point in time. So those kind of data you can collect from any stores or warehouses. Okay. Now, the next question is, at all these various points, now that we have discussed, who should be responsible for collecting the data? Who is the person who should be collecting this data? Yeah. Any ideas on who should be collecting this data?
Yes,
Yes, Festus.
yes, at the head facility, the first facility level, the staff at the head facility level, trained staff are supposed to be collecting data, although in some places we don't have trained staff, but whoever that is working there, because like the consumption data, you're working in a pharmacy, where you have the pharmacy account register, they're supposed to be the data, the consumption data is supposed to be collected at that point. So the staff responsible for that at the pharmacy level, at the facility level, should be collecting this.
So either it could be a pharmacist at the service delivery point, or you said any other trained personnel who knows how to collect data. Okay. Isaac?
Well, you have mentioned one. You in Nigeria. Hello.
Yes, yes, we can hear you. Carry on. Yeah, Isaac, we can hear you. Please go on. Okay, Isaac, you have muted yourself. Anyone else can also.
Okay, can you hear me
Yeah,
now?
Isaac. Yes, we can. Yeah, Isaac, we can hear you. Go ahead.
Can you hear me now? Can you hear me now? I said the LMC
Yes.
the service delivery point at the state level, at the local government and state level. So you have LMCU coordinators at the local government, you have LMCU coordinators at the state level. So these are people who collect.
So the LMCU coordinators at local government or the state level. Okay.
Okay. Also the
Bakr, so
warehouse manager, also the
yeah.
warehouse manager or whoever is responsible managing the warehouse.
Mhm. Okay, so the warehouse manager or maybe at a warehouse they have a dedicated person for data collection. So and then someone has put on chat, logistics personnel at the point of receiving. Yeah, so that is again at a warehouse level. So it could be a receivings in charge or a warehouse manager or whoever is in charge for receiving of products. They also would be collecting these kind of data. Now, the next one is very important. Um, how should that data be stored? Like in what format should that data be stored? The reason why we're asking this question is because uh, data should also flow from one place to the other. So how should it be stored that facilitates better flow? Yes, Ahmed.
Hello, good evening. I
Good
think
evening.
that data, logistic data should be stored electronically. Yeah,
Mhm.
either in the cloud or web-based, so that everybody can
Okay.
have access to the data, so that there will be visibility in the supply chain. Electronic data,
Mhm.
either
Electronic
cloud or server,
web-based
anything.
storage.
Yeah,
Okay.
web-based or electronic.
Okay. Abu Bakar?
No, that's just what I want to say. Like for instance, in Nigeria, you have this what they call NHLMIS,
Mhm.
where facilities enter directly. All the facilities from the local government, state, even the federal the teaching hospitals enter directly on a bi-monthly basis. And then everybody will be able to see it. And then at a point, they will just cut off that. There's a cutoff point that you cannot access it again. Then another level will be able to take responsibility. That the federal level will now take a decision on resupply and things like so. That's just
Okay.
what I want to say. It's more of an electronic thing.
Yeah. Have you used this system yourself or you have seen it somewhere?
I've used it.
Okay. Now let me quickly ask everyone, do you know about this system that Abu Bakr just talked about? You can just quickly do like a raise of hands. Whoever has seen this system, you
Yes,
can just
I
raise a
do.
hand. Yes, okay. One.
Yes, I
Who else
do
has
know
seen?
about the system.
Two, three.
I also know about the system.
You know
Okay.
about the system.
Okay, let me ask in a different way. Is there someone who does not know about this system? Anyone who does not know about this system? Isaac, we're talking about the national LMIS system where the data is collected directly at the health facility level so that everyone involved can see it directly on the web interface. So who has not seen this system?
Hello.
Yes, Hafsa?
I know the system. I know the system, but I've never used it. I've
You have
never
never used it.
like
Okay.
but I know it
Okay.
exists.
Okay. Mariam, are you raising a hand because you have not seen this system?
Oh, sorry, I answered verbally after raising my hand. I've seen it. I've used
Okay.
it. I know it, sorry.
Okay. So anyone, what I want you to do before the next session, which is on Saturday, if you can extract some screenshots from the system, if it is not very privacy oriented, you can the names of the states or any local government you can redact, but if you can bring a snapshot which shows how data is presented, then we can have a great discussion on how data is presented, how data is analyzed, and what is done with that data. So if anyone can do that, that can really help everyone, and we can have a better discussion like this that we are having right now, but on real data coming out of Nigeria. So if anyone could do that, then just drop us a message on WhatsApp, and then we will have some time allocated for this discussion in the next classroom session. Okay. All right. So we have answered the second last question. No one here said that data could also be stored on paper, because of course you have now graduated to electronic systems. But there are lots of countries even today who first collect the data on paper, and to a large extent they also store a lot of data on paper, and then of course there is some form of electronic transmission from paper to electronic system,
Hello.
but they still store a lot of data on paper. Yes, Isaac, you want to say something?
No, yeah, I just wanted to say that
Yes, we can hear you, Isaac, go on.
there is electronic, but because there are places that it's rather a combination of both that is practice.
So Isaac is saying there are a lot of places in Nigeria where there is still a lot of data collected and stored on paper, and then probably transmitted to an electronic format. Okay, that's also noted. Now, Ahmed, do you want to say something before I move on to the
I
last
think
question?
our supply chain data is also stored as Excel. Sometimes we share our report. Yeah, Excel sheets.
Yep.
I don't know how you
Yep.
call it, database or something.
Yeah. So as Excel spreadsheets, so you can also write Excel spreadsheets. Yeah, because it's not a cloud-based storage, but it's still manual, but electronic in a way of Excel spreadsheets. Okay. Now that you have collected, say, all this supply chain data, which has, you've made all these decisions about supply, resupply, forecasting, procurement, and a lot of other decisions, supply chain decisions. What else do you think could be done with all this data that is collected on a daily, weekly, monthly basis? Do you think there is any other application to it? Josephine?
Hello.
Okay, Isaac, go on.
Hello.
Yes, Isaac. Okay, Mariam, you can go ahead.
I was going to say, people who can use this data make references to it when they're doing other things, such as maybe census or research. They use it as their primary data, or is it rather secondary, since they didn't get it? So they use it as their secondary data as a reference to make their research or census or stuff like that.
Yeah, research, maybe not really census, but I think we could call it surveillance. We'll call it surveillance studies, research studies. So Shrey, you can write surveillance studies and research studies.
Yes.
Ahmed?
Yeah, supply chain data is used in advocacy. It's used in budgeting, advocacy and budgeting.
Okay.
Advocacy and budget, yeah.
We have advocacy, but what kind of advocacy would you do? Can you explain a bit more?
Yeah, currently in Africa, we are seeing that the budget for health is low.
For budget. Okay.
Yeah.
Advocacy for more budget.
Yes, for more budget, for more funding. For more funding.
Advocacy for more funding.
Yeah, from donor or from the public sector.
Okay, excellent. So advocacy for more funding.
Can I say something? Hello?
Yes, please. Please go on, Aminat.
Another way the data collected can be used, for example, when you have a donor or an organization that wants to donate, they might want to have a data of what it is on ground, like what has been the consumption pattern before now.
To facilitate donation, you mean?
Yes.
Yeah, facilitate donations. Shreya, the second point was advocacy for funding. Yes, Aminat, please carry on.
Hello? Hello?
Yes,
Oh,
yes,
sorry, I
please,
wanted
please.
to clarify with her what she said. Is she can it also be said that it's being used for a stock analysis, kind of?
Uh, we have already discussed supply chain decisions initially. So I'm
Okay.
saying now, what else? So what you just said is covered in the question above, that what are you using that data for? So that analysis for stock keeping, inventory, that we've already covered. Now here we're talking about issues beyond supply chain. Yeah. So Hafsat, please, you can speak.
Yes, I think it can assist in staff recruitment. That we will know the
Yes,
capacity that you have, so you can,
indeed.
that would assist
Yeah,
in
indeed.
knowing the
So
number of staff that you get.
excellent, excellent. No, that's a fair point. So, if you know that your supply chains is are growing and there are less people to manage, then that can also advocate to bring in more human resources. So, Shreya, you can write to advocate for recruitment. Okay. So, I would like to stop here because I mean there are other issues that you can also uncover based on a single set of data. But see now, this is the kind of depth in discussions that are needed when we talk about governance for anything. Okay, so when we talk about governance, we need to look at all the issues surrounding a particular function or a particular, in case of supply chain, when you're governing a state supply chain, there are, first of all, 10 different areas you need to, identify. Then under each area, you need to identify what are the categories, subcategories, and then write down your issues or questions and then try to discuss with everyone what is the ideal scenario and what is currently there, and then how should we improve. So this is like a process that we are trying to give you uh, to understand what governance is in supply chain, what are the implications of poor governance. And we have seen that for centuries now, that we see a lot of stockouts, we see patients not finding products, we see more money being paid for basic supply chain functions, we see poor performance of suppliers, so on and so forth. So if that Shreya, if you can mute. Yeah, thank you. So if poor governance leads to all these issues, how can we create a better governance systems in our supply chains that can help us manage these three flows in a very efficient manner? And the three flows were flow of products, flow of money, and flow of information. Now at the end of your second module, there is an assignment for you which asks you to draw out these flows with the perspective of Nigeria or in the state that you are working in. So after this session, you should be fully aware that how would you draw out a flow diagram. So Shreya, if you quickly go to the flow diagram which was there in today's session, then I can quickly explain that assignment. And then we will discuss that assignment in the beginning of our technical session, next technical session, which is on forecasting. But we will discuss that assignment very quickly. So if you go back, yes, maybe go to the products. Yeah, so you can stop here. So this is like a flow diagram. So in your assignment for module 2, you will have to draw out a flow diagram. How does product flow from a supplier, to your service delivery points? Then similarly, how does money flow between these different places? How does it go from a patient to a supplier who's supplying products? and then how is information collected and how does it flow in that supply chain. So you have to explain all that using a flow diagram, and that would be your assignment for module 2. So that was it mostly for today's session. Okay, so there is a loss of sound for someone. Okay, Isaac, I will write all this on the WhatsApp group. It's much easier. It's difficult to write here because we are a bit beyond time and I don't want to take everyone's time. But this was the end of today's session, and I would like to thank Dr. Okafor for her insights and taking the session on governance as well. We will have Dr. Okafor again in another session on sourcing and procurement. For the next session, we will be joined by another expert, supply chain expert, Ogvuche, where we will discuss forecasting and supply planning. But this session is linked to your assignment, which is on module 2. So please go through your program on the Hive website. I know you have faced some issues with respect to completion, and we have been trying to sort everyone's issues as they're reported. Hopefully, you will not find any further issues as you go along. But in case you face any issues, please drop us a line on WhatsApp, and we will try our best to resolve it as soon as possible. The slides have already been shared on email, so please check your emails. The recording will be shared very soon on your emails and also on WhatsApp. So please, you can message Shreya if you don't receive it in the next couple of days, but most likely it should be sent out tomorrow itself. And if not, then please message Shreya on the WhatsApp group, and the recording will be shared. The next time we will meet would be Saturday, this coming Saturday. The invites for which have been shared already. We will check again and then share the invites on WhatsApp as well. So with that, I would like to thank Dr. Okafor again, and would like to thank our partners for this cohort, the Association of Industrial Pharmacists of Nigeria and the IAPHL Nigeria chapter. Dr. Okafor, if you want to say any final words, please, the floor is all yours.
Thank you very much, Sanjay. I just want to encourage the participants to be up and doing with their assignments, that they should not allow them to compile, so that it will not be difficult for them. So let them do the assignment at the time, the deadline scheduled for that, so that they will not leave 2 weeks assignment to do it just in 1 week. Thank you very much.
Indeed, indeed. Thank you so much, Dr. Okafor. I know you're speaking from experience, and for anyone, if you face any issues, Shreya is your first point of contact on WhatsApp. And then I'm also on that WhatsApp channel. Dr. Okafor is also on that WhatsApp channel. You can also send us technical queries if you have any, and tag us, and we will respond to you as soon as possible. Okay, so with that, I wish you all the very best for this evening, and we'll see you the next week. Thank you so much, Shreya, for organizing the session and managing it, and we will see you all soon. Thank you so much.
Thank you, everyone, and bye.
Everyone.
Bye, everyone.
Thank you.
Bye, please. Have a nice day.
Bye.
Bye,
Thank
everyone.
you.
Bye.
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 Thank you.
Bye. Thank you.
Thank you.